Emergency Medicine Assessment Questionnaire. Following a catalog of assessment programs, the heart, lungs, and abdomen of various patients can be evaluated on the mannequin. The program includes a variety of normal and pathological findings, such as dyspnea with pneumothorax and pulmonary edema, heart with diminished LV function and right ventricular overload, resuscitation of patient with pericardial effusion, trauma with hemothorax and free abdominal fluid, shock, hypertensive emergency, and aortic aneurysm. The program is based on EFAST. You can annotate and measure pleural sliding, seashore sign, cardiac function, effusions, Morrison's pouch, and other relevant findings. The simulator recognizes annotations and provides feedback, producing a detailed competency report with scores. The program contains 4 chapters and 24 patient cases, requiring a total duration of 2 hours.